Hello everyone, thank you for tuning into this webinar stream on YouTube. The question which we're asking ourselves today is, how has the COVID lockdown affected medical education in India? The number what you see on your screen, 70,978, does not have anything to do with the corona crisis, but rather it is the number of students who take admission into MBBS every year. 70,978 is not just a number. It represents all the students who have fulfilled their dreams to join MBBS every year in all corners of the country. This number what you see on your screen, 354,890, is not just a number. It is the total number of students who are studying MBBS in different years all across the country, irrespective of whether government college, private college or central institute, irrespective of whether first year, second year, third year, final year or interns. This webinar, I guess, is addressed to all of you because you are the ones who are primarily affected, and we all are affected in various sorts. Now, the COVID lockdown was totally unexpected and nobody saw it coming, but it is definitely a necessary measure, and I hope all of you are watching this video safe from your homes, maintaining social distancing and ensuring all of you are safe and healthy. This picture what you see is pretty much how life was prior to the COVID lockdown. Students were coming every day for college, they were attending classes, they were attending labs, they were attending clinical postings, they were going about life as usual, and they were having fun with their friends as well. And then COVID happened. And this is the state of all the colleges across the country. Empty classrooms because students are kept at home for their own safety. As a result of empty classrooms, the education has definitely taken a hit. A classroom can only be considered a classroom if the students are present. In the absence of students, a classroom is just a room with desks and a table. The classroom is defined by the students who are there. I'm Dr. Prahlad Kadambi. I am an MD postgraduate resident at the Department of Pediatrics of Meenakshi Medical College Hospital and Research Center, Kanchipuram. I did my MBBS from KIMS Bangalore batch of 2013, and I'll be functioning as a moderator for this webinar. It's with immense privilege that I'd like to introduce the other speakers. The first faculty who will be joining us is Dr. Nagaraj sir. Sir is a professor and head of department at the Department of Microbiology of PS Institute of Medical Sciences, Kuppam. Sir has worked for many years in the field of microbiology and has an immense fan following among all his students of the past, present, and I'm sure of the future also. Dr. Chitra Nagaraj ma'am is currently professor and head of department at the Department of Community Medicine at PS Institute of Medical Sciences, Kuppam. Ma'am has always been student friendly and student oriented in various roles which ma'am has held as academic registrar of KIMS and head of the medical education unit at KIMS Bangalore prior to assuming this role at PS Kuppam. Dr. Sushanth Prabhath Reddy is my colleague here at the Department of Pediatrics at Meenakshi Medical College. He did his MBBS from Rajiv Gandhi Institute of Medical Sciences in Kadapa. Dr. Rachana Pawaskar is an MD postgraduate resident at the Department of Community Medicine at GSMC, Mumbai. She did her MBBS from D.Y. Patil Medical College in Kolhapur and is currently working on COVID duties at Kasturba Hospital in Mumbai, which is the hotspot of Corona in India. Dr. Harsha is my close friend from my undergraduate days. He graduated with me from KIMS Bangalore and is currently working as a casualty medical officer at KIMS Hospital and Research Center in Bangalore. He still works on the front lines in the emergency department at KIMS amidst this corona pandemic. Dr. Devanshu Pathak is also a close friend of mine from my undergraduate days. We did our internship rotations together. He is currently awaiting to join his MS Orthopedics residency at Jawaharlal Nehru Medical College in Belgaum in this academic year. He is also working as a volunteer for the government of Bihar in contact tracing door to door. Dr. Divya Sharma is an intern at Vanivilas General Hospital in Bangalore. She did her MBBS from Saptagiri Institute of Medical Sciences, Bangalore. From students' perspective, we'll be joined by Nishanth, who is a final year MBBS student at Kempegowda Institute of Medical Sciences, Bangalore, to share the perspective from a final year student. Pratik Agarwal is a pre-final year MBBS student at Lokmanya Tilak Municipal College in Mumbai. He'll be representing the opinions of pre-final year MBBS students. Vaishnavi Varagunti is a second year MBBS student at Meenakshi Medical College and Research Center in Kanchipuram. She'll be representing the viewpoints of second year MBBS students. Isha Pawaskar is a first year MBBS student from Prakash Institute of Medical Sciences, Islampur. She'll be representing the viewpoints of first year MBBS students in this webinar. Now, initially our idea was all of us would join in on a Zoom platform to ensure that this webinar is more interactive and we can maybe even debate with one another and share ideas one across. However, due to various logistic reasons and difficult work schedules, it didn't work out as a Zoom platform. So we decided to instead go ahead with individual recordings and merge it together to ensure that the webinar has continuity. Although a Zoom platform would have been most ideal, it didn't work out, but it might work out in the future and in subsequent webinars too. So with that, we tune in to Isha Pawaskar, who is a MBBS student at Prakash Institute of Medical Sciences in Islampur. She joins us from her hometown of Kolhapur to share in her viewpoints.
Hello everyone, I'm Isha Pawaskar, first year MBBS student from Prakash Institute of Medical Sciences, Islampur. The COVID-19 pandemic struck and happened to affect each and every life on our planet in some or the other way. The frontliners are doing their share to battle the virus and protect our health. Those healthy and locked in homes are battling boredom, and I, as a first year medical student, I am battling the fear to complete the syllabus of first year MBBS without face-to-face classes and dissection. All my fellow first year MBBS students would agree that the pattern and scope of study in MBBS is far different than 12th standard, and face-to-face learning and dissection helps us to sail our boats across. But now that we have the tsunami of COVID-19 existing, we are not supposed to sail on our boats. It is said, "Sir salamat to pagdi pachas." And so it is of utmost importance to stay home, to stay safe, and to comply to the rules of lockdown. But how do we combat our academic losses because of the COVID-19 pandemic? Here's what I'm doing and would like to share with you all. So the first and very important thing is not to get pressurized by this overwhelming situation. The portion that was already completed before the lockdown, I see to it that I keep on revising it. I have reserved 3 hours in the morning for anatomy, following which I take a break for 15 minutes, wherein I listen to songs. Next 2 hours are for biochemistry. Then the very natural and awaited break of lunch comes. Post lunch, I watch TV for some time. Then the next 2 hours are for physiology. So until tea time, I learn new concepts, reading them from our textbook and asking doubts to the seniors or even lectures on phone. That way, I feel blessed enough that my seniors and teachers are super helpful. I miss dissections though. Then it's the tea time, and by that time I'm already exhausted studying. So I water the plants in my backyard, listen to music and help my mother with household work. Next 3 hours are divided into 1 hour each for revising anat, physio, biochem respectively. I revise the previously learned topics and pen down the cycles of biochemistry. Then it's dinner time. Post dinner, I have discussion regarding the COVID-19 pandemic and its current updates with my mom and dad. That way I stay updated with news. Post that, I do a training course in the COVID-19 on IGOT, which is an official training website of Government of India. And then I sleep. So that's how my schedule is. I also exercise for 30 minutes, which makes me feel afresh. I'm sure that you all too must have been trying to tackle this phase of your life tactfully and not letting laziness and boredom to get over your heads. Let's prepare well, study well, stay blessed, comply to the rules of lockdown and practice hygiene. Arogyam Dhan Sampada. Remember guys, health is the ultimate wealth. Stay healthy, stay safe.
We just heard from Isha Pawaskar, who shared her account of how the COVID lockdown has affected her as a first year student and how she's going about maintaining herself academically along with her friends as well as with her family too. We now tune in to Vaishnavi, who is joining us from Hyderabad to share her account of how the COVID lockdown has affected her.
Hello everyone, my name is Vaishnavi. I'm an undergraduate student from Meenakshi Medical College doing my second year MBBS. Firstly, I hope everybody is doing great, staying at home. As we all know, due to the outbreak of coronavirus, the entire nation is under a complete lockdown, and we have been practicing social distancing, and we have self-quarantined ourselves. Right now, in this pandemic situation, maybe social distancing and lockdown is the only protective measure that can be taken. But we all know that lockdown has affected our country in various ways, let it be the economical way, our daily routine, and most importantly the education. Firstly, it was thought that the lockdown might end by March 30th, but unfortunately it got extended till April 15th. Now sadly it has been extended till May 3rd due to increase in the coronavirus cases. We can definitely say that the lockdown has messed up our daily routine and our daily schedules. We as medical students, we are missing out a lot of our classes and our clinical postings. Though there have been online classes happening on the Zoom app, and they are helping us out, but still, having online classes is really difficult, and it is really hard to coordinate, as online classes which are taking place on Zoom, the app only allows only 100 participants to participate in one meeting, but we are nearly 150 students in each batch, so it's really difficult for the professors to teach us, and we have been divided into 2 different batches, and the professor has to teach the same topic twice, so it's surely time consuming, and there are a lot of network issues, and most importantly we are missing out on our practical knowledge which we get through our clinical postings. And I'm pretty sure that all the students right now might be missing all the regular classes, and we all are hoping to get back soon to our routine and to our college. And till then, I hope everybody stays home and stays safe, and take care, and thank you.
We just heard from Vaishnavi how online classes, though it has been started, online classes also do have a limitation with regard to the total number of people who can attend, as well as with regard to how beneficial it is as compared to a face-to-face class. We now tune in to Pratik Agarwal, who joins us from Mumbai, who will be sharing his account of how the lockdown has affected a third-year student.
This is Pratik Agarwal, and I'm currently a third-year medical student at MMCRI Mumbai. When talking about how the COVID-19 outbreak and the lockdown as such has affected us, we can possibly divide this into 2 parts. One of them being how it has affected the college, and secondly how it has affected us as an individual. When it comes to how it has affected the college, I feel that mostly the conferences, the fests, the quizzes and all of the colleges have been cancelled, and this has impacted each college a lot. So for example, our college had this fest called Trinity, which is an international fest wherein a lot of people came over from the entire country. So we had a lot of delegates from from different parts of the country, and we had a lot of speakers coming from various parts of the country. These people had all prepared, they might have booked their flights and all too, and suddenly 4 days before the conference could have started, the entire thing shuts down because we get to know that there's been COVID-19 cases in Mumbai and there are no large gatherings allowed. So as such, I feel that all these conferences etc. have been cancelled, and a huge impact of that goes to the college. Secondly, when it comes to academics, I feel that currently our college isn't having any Zoom classes or something. So that is where our portion is somehow just postponing as long as this particular outbreak isn't settled. And there's a lot of uncertainty on whether the exams will be conducted, whether they'll be postponed, or what exactly will be their approach when our colleges reopen. Secondly, when it comes to an individual aspect of it, I feel like it's a very I shouldn't say this, but it's a very positive thing when it comes to these students, because we get a lot of time to ourselves. And I feel like when you come to third year or final year, at this time, a majority of time needs to be spent on yourself and on how you can understand those things by your own, because self-study becomes key here. A lot of initial concepts have been learnt, and you can grasp the later books too. But the only thing that you need is time, which you get here. You get a lot of time, 1 month or 2 months, or maybe just extending that. We get a lot of time to brush through our previous concepts and to learn a lot more, to somehow just assimilate everything that we have right now, and to keep on adding information, which we can do when we go to college. But a lot of time gets spent in traveling. If you're a localite, you spend half an hour to 1 hour traveling here in Mumbai. Then secondly, a lot of time gets spent in between the lectures or any other place where you could actually have made it productive. So when you're at home, a lot of time can be spent on studying, on taking new books for studying, and on discovering foreign authors or whatever you want. You don't really need to think about time. You can now think about the concepts that you want to master. So that's definitely a positive thing. And I would rather like to advocate that for third and final year, we should stop having compulsory attendances or anything of that sorts, because this is the time when they can master their skills by themselves too, and they should be given the opportunity to do that. That's it from my side. Thank you.
Thank you, Pratik, for that wonderful talk on how the lockdown has affected a third-year student. Personally, I agree with you when you say that everything is oriented towards self-study and there should be adequate time to prepare on one's own. And with regard to missing out on conferences and other meetings as well as other activities and fests, yes, these are an integral part of our medical curriculum, and it's unfortunate that the lockdown is resulting in missing out on these. But with regard to the attendance, well, like it or not, attendance is a part of the curriculum and is unfortunately or fortunately here to stay. So with that, we now tune in to Nishant, who joined from Bangalore, with his viewpoints on how final year students are affected because of the lockdown.
Corona, a virus that has caused a global pandemic, silencing even the top-notch countries of the world. I am Nishant, a final year MBBS student from Kempega Royal Institute of Medical Sciences, Bangalore. So this pandemic has caused a lot of problems in the whole world, be it food, shelter, or the crashing economy of every single country. Every single person has his or her own problems. Likewise, the medical students, especially the final year medical students, have their own set of problems. So the first problem is that a final year medical student should have something called as the patient exposure. That is, you go to a patient, take his or her history, examine, then come to a conclusion, diagnosis, and then treatment, and that is the process of learning. But we have been quarantined at our homes. It's been almost a month now, so we haven't actually gone to the hospital, taken cases and studied. So it's a very difficult time for us without looking at the cases. I mean to study without looking at the cases. Theory part is different because that is kind of sorted if you study on your own, or the online classes are doing justice to the theory. But whereas, when it comes to the clinicals part of it, that is where the problem is. So as a result, we are kind of drifting away from the actual curriculum. Like our actual curriculum has a few days, like a month or a month and 10 days, 2 months given to each subject. But all these days of quarantine, we lose all those days, and then we have to, cramp up the curriculum in whatever time we get. That is one point to it. And the second thing is, after the corona ends, hoping that it will end soon, the number of patients who come on an everyday basis will be very less when compared to the number which were previously coming, because I really think people will still be scared of the virus and they still, they will try to avoid going outside. Only if it's a very emergency situation will they come out. Otherwise, I don't think they will come out. If it's something very, very minimal, I don't think they will come out to the hospital to show it to the doctor. That is another point which could happen in the future. And the other aspect is that the number of quarantine days, if I may call it holidays, aren't that really good for any medical student. As a medical student, we don't get holidays, right? So, as a final year student, you will be focused from the day one, saying you're in final year, you have to pass this year, you have to be a doctor, and you'll have your goals set, and you'll have something like a daily routine where you have to get up and do your daily chores and then go to the hospital, then study and everything. But then if things like holidays come into picture, then your sleep cycle varies and your whole routine just changes and you lose your focus. Mental strength is one of the main things that the quarantine days are testing, at least for a medical student. I really think people will lose focus on the subject, and they really can't concentrate during these days on the subject part of it. So one more problem is that the hostelites were sent back to their homes. So when they were going back, they only took very few essentials needed, and they never took their books, hoping that they'll be back to the hostel like say a couple of days, 3 days, 1 week or something. But they never knew that this will take so long. So that is one more problem. So summing it all up, it's a very difficult times in each of our lives, but we have to go through this if the country has to do well, or say if the world has to do well. Right now India is in a great position. It's doing real good work. That is possible because of all of you guys, because you guys are staying home. You guys are helping the government achieve such a great thing. I hope that the whole pandemic comes down soon and we get back to our lives as soon as possible. Let's all hope for the best. Thank you very much.
Thank you, Nishant, for sharing a final year perspective. Final years are undoubtedly the ones who are maximally affected because they are the ones who will be joining the workforce as interns shortly. And of course, a clinical posting is very important to a final year student because they are just one step away from becoming full-fledged doctors. We now tune in to Dr. Divya Sharma, who also joins us from Bangalore amidst her work schedule at Vanivilas General Hospital. She'll be sharing an account from an intern's perspective.
Hi everyone, I'm Dr. Sharma and I'm an intern right now. And today I would like to address the topic of medical education and a lockdown. Now as doctors, we practice medicine. We just don't do medicine because medicine is an ever-evolving field. We need continuous practice, we need practical experience and flowing updates. And the same thing applies to medical students because most of the medical students learn their knowledge by either doing experiments in a lab or by interacting with patients in a ward, not just by sitting in a room stuck with their books alone. And a lockdown is what is going to curb these advanced learning opportunities for such medical students. Over the world, about 118 schools have been suspended and about 1.5 brilliant young minds devoid of education. And a vast percentage of this are medical students. And this has an impact not only just on their knowledge but also mental health. In a backdrop of medical students succumbing to anxiety and stress due to the overwhelming amount of knowledge that they are supposed to gain during the time frame of the medical school and put into a good use, this lockdown now curbs the time frame. It shortens the period that they have to learn this truckload of information. So in the coming days, we might see a rise of anxiety, stress, depression and suicidal thoughts amongst the medical students. This lockdown is affecting, according to me, 4 main categories. One is the medical students, the second being the interns, the third being the postgraduates working as doctors, and the fourth, which is the most vulnerable group of all, are the students who are preparing for their PG courses during this time. Now, how are medical students being affected? I feel most of them as what I interviewed my juniors, they feel demotivated because the lockdown started during the beginning of the year, and now they don't know where to start. They don't know how to make a timetable and finish what they're supposed to do. And also they feel directionless, and because while they're reading a topic and they do not understand it completely, and they spend more time trying to figure out the intricacies of medical knowledge, they don't have any immediate help. So they start procrastinating what they're reading. They're like, okay, I cannot do it now, I'm not going to put the effort, I'll do it later. And this is how they're not able to study at home. Also, a good study space is required, like maybe a library, but at home, due to the continuous news updates, a lot of restrictions and anxiety with the family members, they are not having a good study space to actually just sit down and have a focused studying. And also, as a medical student, I loved and I still do love group discussions, and that is obviously not possible in a setting of a lockdown. So all these things are affecting medical students, and the minute schools reopen, they are going to be flooded by assignments, flooded by postings, and overwhelmed by numerous exams that they'll have to take in a short time period. Next coming in interns, as this is like really sad. I feel so bad because I'm an intern right now, and I'm not able to do all the things that I dreamed of doing because most of the departments are shut down, and most of the hospitals are just changed into a COVID unit. With this, there are less OPD cases and inpatient cases. So my or any of the interns right now, their medical exposure has been drastically fallen down. And the same goes for PGs, especially the PGs in Dermat or Ophthal or ENT. They hardly have any cases right now because only medicine and emergency cases are being admitted right now. And also, though I have a formal coaching of 4.5 years, I wasn't prepared for this. None of the interns were prepared for this. We didn't know how to use PPEs. We weren't prepared to counsel patients and their family members to be alone during this time and be isolated for 28 days just because they're sick or came in contact with a sick patient. So we weren't really prepared for this, and right now no one has the time to teach you. You either learn it on your own or you learn it by experience. But so this has greatly impacted my batch of interns and even the postgraduates right now who are working in the hospitals. And comes to the last group of people, the most vulnerable. Those are the students who are preparing for their PG courses. Now, usually in an Indian setting, after internship, students take 1 year of gap to prepare for the exams. And during this 1 year of gap, they go for coaching centers who prepare the timetable and teach them what they're supposed to know. With all of this lockdown and pandemic, this is not able to happen, and most of the coachings are being doing online, like on their phone or the laptops. Now, what is the disadvantage of it? First thing, a lot of screen time. We all know that a lot of screen time with blue light and white light actually disrupts our sleep cycle. It causes stress to our eyes and brain also. So this is being increased, and this might actually lead to more anxiety among students. And a lot of students, like my seniors, are stuck in the hostels because they couldn't go back home. Now, being in a hostel, doing online coaching for a PG course during a pandemic can be really stressful because they don't have proper food, and sometimes even the internet is not good, and this is so practical, but they're just not able to study well and feel demotivated, and the anxiety thus rises. So what can we do to address these situations and problems? First, for medical students, I feel the seniors should really step up because we have been medical students just by a year or 2 years back. So we exactly know what they're feeling and we exactly know what they need. Either we make timetables for them and help them out, or we do simulations like case presentations, or even doctors who are actually interacting with patients right now in the hospital can make a video of it and how they came up to the diagnosis, how they treated the patient, and actually send it to their students. So they can have a virtual experience of everything that's going around their hospital, and they feel motivated to study. And the medical students themselves, if you like group discussions, you can probably have like a Zoom meeting or a meeting with all your friends and then discuss a topic and help yourself. And also try to create a good study environment in your house maybe select a room and tell that your house members that for 3 hours no one disturbs me, this is like a library. So maybe you can try doing all of this and stay motivated. All I want to tell you guys is you aren't stuck at home, you are safe at home, and this is a golden period. You are never ever going to get a stop and like a month off to just study, so please utilize it. And coming to interns and postgraduates, I mean, I think the most horrible brunt is being faced by us, because we had so many dreams and aspirations for our practical experience in the hospital. But I think as of now, what we can do, even if we are posted in the COVID units, most of the sick cases are not just COVID patients. They have comorbidities like hypertension, diabetes, congestive heart failure, or renal diseases. So we can actually try to get an overall view in treating these critical patients. And wait, if you can treat critical patients, I'm sure you will be able to treat the non-critical patients, because you have already read all that can go wrong in a patient with diabetes or hypertension with COVID. So we can try to do that and stay motivated. And once the lockdown ends, try to put a little more effort in going to the hospital and learning as much as we can. And coming to the students who are doing PG courses, either Indian or Indian PG or USMLE. So the thing is about USMLE, most of the students prepare on their own with online resources, because most of the videos are online. What we can do is decrease our screen time during the day, like probably to 6 to 7 hours, because I know that's needed. And also before sleeping, like 1 hour before sleeping, we should stop the screen, because so that it does not disrupt our sleep cycle and melatonin levels. So that can be done. And whenever we take a break, we should probably just do something at home, like exercise or dance or play, or just reward yourself with something nice, like a movie or anything, a play with your family members. So this will keep us motivated and it will not become monotonous. And in the end, the most important aspect that I would like to address is the mental health during this lockdown. But the thing is, while doing a write-up on this, I went through some articles by the Lancet, and it has been proven in research that all the lockdowns in the previous pandemics or the past and right now, most of them had a negative impact on the vulnerable groups of people. Who are they? Either the elderly, or people with previous psychiatric illnesses, or women who are facing domestic violence and a bad house environment, or students, because students are overwhelmed with the kind of knowledge and time frame that they have to work accordingly. So I think we all should address these vulnerable groups, and by probably media, social media, to motivate them to make good videos, to send motivating thoughts to these vulnerable groups, and also relief workers who can go and counsel either by telecommunication or also to provide them support in some other ways. And I think all of these aspects, once they're addressed in the short term, we have to look at the long-term consequences. That is, when we phase out of the lockdown, how are we going to help the medical students? I don't think like in any medical school, we have to write a lot of records. And most of the time, those records are not of use, because if we do our case presentations and write a logbook of cases, well, I don't think the records are needed, right? So something like that, I think the institutions should cut down on the unnecessary things and try to focus on students, on gaining the knowledge. Same goes for interns and PG courses. I just hope that we'll all be able to phase out of this lockdown well, without any long-term consequences, or not very drastic ones. And I hope all of us can come together to help all of you out. And I would like to thank Dr. Prahlad for giving me an opportunity to address this topic, and I hope it make a difference to all of you. Bye.
Dr. Divya rightly summed up from an intern's perspective the challenges which are faced on a day-to-day basis. These challenges which nobody foresaw to have happened. I'm sure that she has summed up the opinions of pretty much all the interns all over the country, and more or less everyone are facing the same challenges. So with that, we now move on to Dr. Devanshu Pathak, who will be joining us from Patna, who shares his opinion on how the lockdown has affected the medical education.
Good evening, friends. Myself, Dr. Devanshu Pathak, MS Orthopedics Junior Resident from JNMC Belgaum first year. Today I am going to discuss about the mental health effect of the school closure during COVID-19 outbreak. According to the recent data of the UNESCO, 188 countries have implemented strict lockdown and social distancing to control the transmission of COVID-19. Because of that, nearly all the schools and medical schools and the normal schools, everything is completely shut down, everything is closed, and because of that, roughly 1.5 billion young people are out of the education. Vast majority of them are medical students, so they are out of the medical educations. Many medical colleges have started online teaching programs, but basically what I want to discuss here is medicine is not something that you can learn on online platform or some social media and everything, because in medicine, by interacting with patients, we gain by doing experiments in the lab. Starting from the very first year of MBBS, like anatomy, you cannot have a good exposure through online videos. There are so many online videos of the dissection, but when you do the dissection, you get everything, like which is artery, which is vein, which is muscle, which is running from where, everything like surface marking we do. This will have a very different impact. So this we should think that because of this, medicine is basically an ever-growing field, and we need to update ourselves day to day so that we can deliver proper and perfect treatment to the patients. In this COVID-19 also, like till date, we have not reached to a definitive treatment for this. The reason I'll tell you one. In medical conferences, when we go to the medical conferences and when we present or when we discuss among the groups, we evolve ideas and we can get the different researches and we can think over it, and then we can do further more researches from that data and all. Because of this lockdown and social distancing, we are not able to gather together and we can discuss so that we can deal with some drugs, and we can make a drug and we can deal with this corona outbreak. So this is a very pathetic situation for the entire world. Sitting in the room with medical books will fetch us not much. The same thing if we are doing in the wards, we will gain much more knowledge and it will be durable. Basically, for the final year students, medicine, surgery, and a number of times if you read it, you will not remember. But if you see one case of that, and then you correlate your clinical knowledge with the knowledge which is written in the books, and when we can integrate it, when the staffs, when the professors will teach you that, the patients, when they will show you, oh, this is like this, so that will have a very different impact. So because of these things, the medical students are going towards mental issues. They are having, like many people are falling into depression with this, and just after this lockdown gets, many people can't revert back to their normal lives immediately. They will also take time. So we should think over it, and we should also do a study, and we should keep a monitoring on these young students who are basically, see, medical science is basically very vast, so people get depressed in long term. So, and on phone calls or on online platform, we cannot counsel them properly. We need face-to-face sessions for that, and that is also not possible in this lockdown. So we should think over it, and there are many families where the parents are unemployed because of this lockdown. There is family income is like cut off. So we should also help these families and these students. There are some special mental issues facing like autistic patients, autistic children. Autistic children, you should they are a very sophisticated type. Like they are very planned to their routine, and if they deviate from that, affected up to some extent. Fine. So this, I hope that we get out of this problem very soon. We are also working here day and night. Recently, I belong from Bihar, and we have almost 90 cases of corona with 3 deaths, and 16-17 districts are hotspot here. So we have started house to house survey as per the government instructions. House to house survey, in that we are going to each and every house and we are enlisting the name of the patient, any travel history is there or not, any symptoms or things related to corona. Basically, the symptoms of corona is there is a shift from the normal symptoms. Like recently, you people must have seen on the television and on the newspaper also that there are asymptomatic corona cases also emerging, and that is a big challenge in upcoming time. This is a very big challenge. So I hope that we get out of this. Thank you very much.
Thank you, Dr. Devanshu. He brought about a very valid point with regard to families being affected as a whole, and with regard to the mental status of all individuals, and to ensure that we all do keep a positive frame of mind while going about ourselves through this pandemic. We now tune in to Dr. Sushanth Reddy from Kanchipuram, who will be sharing his account of what he feels is affected because of the lockdown.
Hi, my name is Dr. Sushanth Prabhath Reddy, and I'm studying first year postgraduate in Meenakshi Middle College, Kanchipuram. I'd like to address you today some of the common problems we are facing today in India, especially I'm addressing the problems related to the medical students, the issues related to the COVID lockdown. So coming about the COVID lockdown, we all have heard in the news that it's a grave emergency. We should maintain social distancing and should maintain quarantine those who have been affected and all. So I'm just briefly going to talk to you about how the common medical student will be affected, is affected right now, regarding their academic activities, regarding their postings, regarding their ability to see the patients with proper equipment and PPEs and all. So starting with the first point, I'd like to talk about how their academic activities are affected. So generally coming to the academic activities, we have seen that most of the medical colleges throughout India have ordered closure and stopping of all academic activities, and they have been told to go home. So in that way, the academic calendar, though it is actually very less, we are having a shortage of classes, so we won't be able to properly learn the subject. So in order to circumvent this problem, we have to look for alternative means, such as the online classes. Webinars are available in YouTube. You can look at the IAP webinars. Sometimes in respect to pediatrics, I'm talking about pediatrics. So IAP webinars are available for you to just go through the different topics. And despite of that, you can also go through the Open Pediatric website. It is a beautiful website which you can see all the pediatric modules and you can learn from it. On top of that, the IAP teaching modules are also available. With that, you can just go through all the different topics and prepare yourself. So during desperate times like this, when we cannot avail face-to-face classes and faculty, we have to adjust with the online classes. So this is about the academic things. And regarding the students, they'll feel hopeless and despair and all. No need to lose hope. This is a crisis not only faced by India, it is throughout the world. So if it's the situation is bad for us, the situation will be bad for everyone. So I request all students not to lose hope and to just focus on how to productively utilize their time. So first and foremost, we should not use hope. We should utilize the time available. So this time, a lot of people will think, I want to relax, I want to enjoy my time. You can relax, you can just enjoy the quality time with your family, friends and family, but maintaining social distancing. So, and regarding the how to best utilize the time, you can use the online classes, online videos. Otherwise, you can just Zoom app is also available. It's a beautiful application. You can just do video conferencing. You can directly contact other faculties and other students and just whatever doubts you have, you can get it clear. So, like that, these are different ways you can just go through the academic section. Now, coming to the postings and all, it is true that you will lose your clinical exposure, but you should also bear in mind that the cost of the clinical exposure should not be at the expense of safety of our medical students and the CRRTs. So basically, without proper personal protection equipment, which has been provided to us, which anyway there is shortage of throughout the medical college, so we are not equipped to deal with this treating corona. So don't think that okay, I'm not able to treat corona because we are not provided PPE kits. PPE kits are shortage throughout the country. So please just try to understand the situation and the best possible circumstances for you to maintain social distancing, be at home until this crisis is resolved. When we can stop the stage 3 spread of the disease and flatten the curve, then I think we can resume our day-to-day activities. So until then, I would like you to maintain social distance at home, try to best utilize the time, spend quality time with your family and friends, and so don't lose hope and despair. We will get through this. We have gone through a lot before and we will go through more again. So the thing is, we should go with grit and determination. I wish you all the best.
Thank you, Dr. Sushanth. He raised a very valid point with regard to multiple resources being available online, be it through IAP webinars, be it through other resources online. And I guess all we should do is to ensure that we do make maximal use of whatever resources are available in addition to whatever resources we do have on a face-to-face setting. With that, we now move on to listening to Dr. Harsha, who joins us from Bangalore with his opinion on how the COVID lockdown has affected the education system.
This is an anxious and uncertain time for everyone, our nearest and dearest. I am Dr. Harsha, working as Casualty Medical Officer at KIMS Hospital and Research Center, Bengaluru. The world is facing a pandemic that has claimed a lot of lives. This lockdown has affected the academic calendar, especially for the medical students. Medical students are missing out their practical experience. Their learning is at the bedside. There is no way that you can learn clinical skills from reading. It needs to be practical. Medical curriculum consists of bedside teaching in hospitals. Despite academic material having been uploaded onto online platforms, bedside teaching cannot be delivered without the practical experience. Most students in India can't get to their colleges and universities are scrambling to put together online teaching systems. According to UNESCO, some 1.37 billion students across 138 countries are suffering due to closure of schools and colleges, and nearly 60.2 million teaching faculty are no longer in the classrooms. Digital capabilities are not distributed, and students' access to computers is also an issue. The most common technical issue that is causing the problem is with the video freezing and making for a bumpy course experience. In physical classroom setting, interaction is more dynamic and course instructors can stimulate feedback from students more easily. The practical experience on practicing how to draw blood and how to administer an injection cannot be learned online. Finally, at the end, our medical students are left pondering whether it would be best to leave the safety of their homes and return to the clinical settings to tackle the pandemic head-on, or remain at home and try learn clinical skills through online platform.
Thank you, Dr. Harsha, for raising a very valid practical point about whether our technological ecosystem is strong enough to bear this additional burden. Whether we are able to successfully adopt this technology or not, time alone can tell. But at present, all we can say is we are definitely under-equipped to ensure that these online classes replace face-to-face classes. Whether it's a replacement or whether it's an adjuvant to all of these face-to-face classes, I guess time alone is a deciding factor. With that, we'll now move on to listen to Dr. Rachana Pawaskar, who joins us from Mumbai, to share her viewpoint on how the lockdown has affected all of us in the medical fraternity.
Good morning, everyone. It's a great day and I'm heading towards hospital for my duty. I'm Dr. Rachana Pawaskar, first year resident in community medicine from GSMC Medical College and KM Hospital, Mumbai. I hope that you all are safe in your homes amidst the COVID-19 pandemic and that all of you are complying to the norms of the lockdown, maintaining respiratory and personal hygiene and social distancing. Grappling this insecurity regarding how large the footprint of COVID-19 is going to be on the world and how long the lockdown is going to exist. Everyone seems to just hold on to hope that all will be fine soon. But as medical students, you have an additional bothering, right? It's how to cope up with the syllabus without regular classes, how to study efficiently, and how to go about the entire process. We have great speakers who will track the path for you. Just to add a bit, I would like to tell you all to prepare a time, a schedule, and divide the day accordingly, giving each subject a stipulated period of time. Revise on your previously learned concepts well and dive deep into learning new ones. We have many online sources and classes these days which you can rely upon. So you have to eat well, sleep well, but not more than 6 hours. So it shouldn't be only study the entire day. Taking short breaks to refresh yourself is important. You may indulge into music, cooking, cleaning, or playing indoor games. So yeah, that's all about the routine stuff that I wanted to tell you. It's not my sole purpose of having a word with you all. I would like to sensitize you to the bigger picture. How many of you have thought about COVID-19 as an opportunity to learn beyond the routine subjects of the MBBS curriculum? How many of you have made an attempt, an effort to understand how things are going around in the world? Being budding doctors, it is our professional and moral responsibility to know about the ins and outs of this disease, isn't it? How many of you have made an effort to check the updates of COVID-19 beyond the TV news? If you have done, it's humongously applaudable. But if you haven't, let's all walk through the potential areas of learning amidst this pandemic. First and foremost, who decides whether a particular disease is a pandemic? Yeah, you got me right, guys. It is WHO, that is WHO, that is the World Health Organization, who decides that a particular disease is pandemic. But then how? Do we know how it operates at the global level? Nope. I'll be sharing some resources with you at the end of my talk, and you can go through these links and learn more about it. The Government of India has also initiated online training courses for us, and one can access and learn from them too. Infection control and prevention is a crucial aspect of the entire pandemic control, and we as medical professionals need to be well versed with it. So, yeah. How many of us really know the steps of hand washing? How many of us know how to correctly wear the N95? How many of us know how to wear the PPE, the steps of wearing PPE? Yeah, so these are all the practical requirements that we ought to know. I was fortunate enough that I got the training regarding infection control and prevention during my UG curriculum. But then you might or you might not get in your colleges, but you all need to know that. And I'm sharing the links for the same. So what I mean to say is prioritize on studying well, completing the subjects. And then maybe 30 minutes per day for the COVID updates is fair enough. Not more than that, obviously. I'm sure you will all maintain the balance. Remember, guys, better equipped are we, better we will be able to serve. And I conclude with a wish for you all. Sarvepi sukhina santu, sarve santu naramayaha, which means may you all stay happy and may you all stay healthy. Thank you. Bye-bye. Have a great day.
Thank you, Dr. Rachana, for sharing that positive message with all of us. and I'm sure all of us agree that she gave us a lot to think about. These are the links which she wanted to share in her talk. Those of us who are interested to gain further information and knowledge can definitely log in and enrich ourselves with a higher update. With that, I also would like to share a few of my own personal thoughts. You can listen in shortly. Dr. Prahlad here. It's unfortunate that we have to record this video among these disturbing times. Nobody in their wildest dreams would have even imagined that the COVID outbreak would become the world pandemic, what it has. And like you all saw in the initial bit, it's the medical students who have borne a large brunt of it. Maybe not as much as the vulnerable sections of society. But yes, I think all of us can unanimously agree that medical students and medical education as a whole has taken a hit. Now, you're all listening to me probably after hearing all the other speakers, and I don't want to be repetitive in what I have to say. But I think definitely one key aspect which many people have emphasized upon is online classes. Online classes can definitely not replace a face-to-face teaching setting. Now, while you might be listening to me over YouTube webinar, I'm sure the message would definitely be more conveyable if it was in a face-to-face setting or in a town hall setting. But under the current scenario, having online classes is merely a way to ensure that there is academic continuity, and by maintaining this academic continuity, the students are not out of touch with their syllabus. So that is of course the first thing. Second thing, as far as the clinical postings are concerned, which Nishanth did mention, in the clinical postings, yes, face-to-face interaction is a must. You do learn how to examine a patient. But under the current scenario, it is definitely not advisable to allow anyone to come forward. Now, we all know that there is a shortage of personal protective equipment, and even amongst treatment protocols, the world's finest minds are having academic debates on this setting to ensure that the best treatment protocol is devised. So, if you do consider the COVID scenario, right now it is best to stay at home and maintain social distancing and adequate protection. Now, to an undergraduate perspective, I will divide my next few minutes into undergraduate and postgraduate separately. Now, to a UG, depending on the year of study, their awareness and orientation towards the system of medicine is entirely different. Now, the first year and second year you can somewhat club together, and third and final years and internship you can see together. Of course, interns do continue to work in the hospital setting and their routine is not as badly affected, but to an extent, yes, they are affected in terms of their maybe case exposure, because they might not be seeing all the variety of cases right now. Final years, of course, do have their worries about exams, and as much as none of us do like exams, exam is an integral part of our curriculum, and of course, right now it's not the exam going semester immediately, but if this situation were to continue, I'm sure that certain measures would be taken to ensure that exams are brought under streamline. Now, the third year MBBS, of course, is generally considered to be the free duration, where people can focus on their cultural activities and other interests. Some of them even start PG preparation at that time. To a larger degree, they are not affected, but third year is also the time where many people lay the foundation of theory reading for medicine, surgery, obstetrics and pediatrics. Of course, theory reading, this is an ideal time to go ahead with that, so I would advise my third year friends who are watching this to carry about that. Regarding first year and second year, of course, first year is very practical oriented. Many people do take a minimum of 6 months to get oriented to how the medical system works. And of course, 6 months would be over by now, but as they reach the end of their academic year, I think they are the ones who are facing a maximum difficulty right now, especially in the practical aspect of it. So I'm sure that there will be a way to compensate that. But in the meantime, online resources do go a long way in ensuring that they are at least up to speed and have some knowledge and they're not totally out of sync. If you consider the graduates who will now come out immediately post this COVID era, I'm sure their exposure, their attitudes and their approach towards patients would be entirely different. But friends, one thing I would like to re-emphasize is that at the end of the day, all of us who are residents, those of us who are training us as faculty, and those of you who are watching this video and will become doctors in the future, we all do have one point in common, and all of us are the future of the medical fraternity. And looking to where the future lies is important, and it's very important not to give up hope and to ensure that we do keep a positive frame of mind and we do keep ourselves updated with the recent advances. Just a minute to maybe address my fellow postgraduate colleagues all over the country, maybe even around the world if they are tuning in. As a part of our postgraduate curriculum, a dissertation is very important, and dissertation is often the mainstay of postgraduate to differentiate UG as well as a PG teaching. Now, those who are affected as far as data collection for the dissertation is concerned have no choice but to wait until the lockdown is over. But in the meantime, if they're not able to even go for the data collection, they can focus on their review of literature, they can focus on revising their objectives, and they can even focus on the statistical analysis if the data collection part of it is over, to ensure that this time is not wasted. Time is precious, and we all know that time once lost can never be regained again. But of course, if depending upon whatever stage they are in their dissertation, this is an ideal time to focus upon dissertation work. Personally, I'm working on the review of literature part and side by side going about data collection. Though, of course, I wish that progress would be faster, but I am able to go about it personally. That's personally aspect from my side. In general, to just sum up what I would like to say, I would like to give a positive message amidst these trying times. Don't give up hope. All will be well. The world's brightest minds are working upon finding a cure for COVID. Let's all do our bit to pitch in to ensure that social distancing is maintained. Those of us who are working in clinics and in the field, of course, I do wish all of them to stay safe. And also, I do give out a message to everyone to try to help out others as far as possible, engage in academic discussions, and to ensure that we do stay ourselves up to date as far as knowledge is concerned. Because end of the day, knowledge is power, and that is what will separate all of us as good doctors and doctors who have come out of this COVID generation.
We now move on to listening to faculty perspectives. The first faculty whom we'll be hearing from is Dr. Nagaraj sir, who is a professor and head of department at the Department of Microbiology in PS Institute of Medical Sciences, Kuppam. Sir has a very strong message which he would like to share to all of us.
Start. Hello friends. Days of Corona. Corona being a very small virus belongs to the group of the coronaviruses, which are the smallest among the group of viruses and usually associated with the causation of common cold associated with sore throat, fever and symptoms like this. Cytokine surge causes some complications which can result in the causation of complications such as the pneumonias that are caused and death that may be associated with the disease. Being a microbiologist, I know about the corona and I'm not scared about this virus, which is such a simple virus, small virus associated, and it is easily destroyable with soap and water. Hand washing is one of the most important aspects which have been told, and one should never be afraid of facing the realities of life. Coming to the boring days, I would like to remind you of Sir Isaac Newton. Newton did his gravitational experiments during the plague, a pandemic that occurred, where he also had to stay back home and observe at the skies doing some research. See, whenever there is a adverse condition, the human mind becomes very, very active, and this is where you try to develop and improve your thinking. Use your brain for positive thinking so that you can come out with some of the important aspects of research that can go on. Medical field, very rarely you find people doing research on medicine, and I think this type of a situation puts you up into a lot of encouraging days. Though you feel bored, your mind, you allow it to flow freely so that you can come out with something new that can develop. I would like to now tell about our own hospital, where fortunately enough we don't have cases, but there are cases and we have to be prepared. We have to be prepared. See, complacence is one thing, and knowing, complacence is not the thing. The word is, you have to be very careful whenever you know that something is coming and going to strike us. We know about the enemy that is going to come. We know its behavior right now. We are not very much scared about the situation. We have methods of protecting ourselves. What have we done in PESIMS? I am in charge of the hospital infection control, and the major thing of prevention of this corona spread, I am responsible within the hospital. So what have we done in our own setup? We have tried to provide prophylaxis with hydroxychloroquine to most of our staff who are capable of taking the hydroxyquinoline, and they are protected to a great extent. And whenever we have to approach a patient or a suspected patient, not actually suspected, it should be a probable diagnosis. When you come across a probable diagnosis, you try to protect yourself from the supposed to be infected patient. It may be positive, it may be negative, but we have to be careful whenever we approach as medical people. Then we have provided enough prophylactic, not only prophylaxis but also enough quantities of personal protective equipments. And coming to a point, see, the question is, whenever an outbreak like this occurs, see, I have seen the plague outbreak of 1995, I have seen the SARS of the 2000s, then I have seen the swine flu that came up later, and that also between the last 10 years we have seen 2-3 major pandemics that went on the world. Was the SARS, then MERS, then you had the swine flu, and bird flu is continuously going on in our environment. These are the main things. When I was a small kid, I also had an opportunity of being quarantined or house arrested because I was a very small kid, and when Asian flu struck India also, part of that Asian flu, I remember being in the house those days. So this is basically an important aspect. As young students, what you have to know, apart from actually attending the classes and online classes, that technology has come up so much that we have to be updated. Apart from updating, you also have enough time to learn more about the situation that is there, and you have to try to say what is the actual basis. Some of you who have completed your first year MBBS and who are the second MBBS or beyond, especially second MBBS and beyond, you learn about the virology aspects of it. If you see, the virus is basically an enterovirus, but recently it has been segregated from enteroviruses because they do not cross the acid barrier of the stomach. A high pH, low pH, low pH in the stomach kills the organisms, and it comes as a rhinovirus. That is a basic thing that one has to know. See, why you should know about these things, the theoretical aspects is, when you are trying to do some control measures, you always have the thing. I continue with what are the other things that we have done in our hospital. We have tried to now actually preserve whatever is the protectives that we are having, where the things we expect, the spurious material that would come up because of the lack of availability of material in the world, then the question of cost cutting that has to be done, because economics is the one thing which actually takes the country to very low levels, especially when the entire country has so many patients coming up. Fortunately enough, India has not gone to the stage like America or Europe, where the case numbers are very, very high. That is very fortunate for us. And we have now developed a UV light sterilization box so that we can actually reuse our N95 mask. That has been our innovation during this part of the corona outbreak. Then we have tried to change over to the unwoven cotton paper that is there, that comes as a packing material for the CSSD material. That can be autoclaved, and we can reuse the whole thing out, still cutting the cost. This is much better than using a cloth-based bedspreads and pillows, because this can be definitely reused. At the same time, we can also see that patient-to-patient transfer of these viruses can be prevented. Please note that this virus is only spread through the droplets, but people are so scared as though it is a case of a airborne infection. See, this type of wrong information running around in the community, especially with the advancement of technology. Every one of you, actually, there is more amount of coronavirus in our own mobiles rather than the actual number of cases. All the mobile mobiles are infected with corona, and a lot of information. Many of them are not true. A few of them are very, very true, but we have no idea of whether we are trying to actually get the correct information or the wrong information. So trying to understand these things is very, very important. And boldness, a person who wins the war is the one who is bold and faces the reaction. I'm really very happy that some of our interns who have just passed their final year have gone to the field where there are positive cases. See, what they did not learn during the course, they are now learning in the field. Field gives you real experience and the reality of life and how to live in an adverse situation, which you never learned during your studentship. Because all the time you are totally dependent on your parents and we are living on that. But we have to come out of that state of thing so that we are able to actually live much comfortably, make ourselves comfortable, at the same time not getting feared out and staying in the house and keeping to the room because of fear. Fear has to be removed from all of us. See, once we have taken medicine, these things are very, very common. See, you think of simple organisms like Microbiology tuberculosis. It's much more sturdier organism, much more problematic organism. Number of percentage of deaths that occur due to mycobacterial infections are much higher compared to the corona, but still you are afraid of corona. So we have to know what we are dealing. There are much problematic viruses like Ebola, then Marburg ones, then you have got number of other viruses and bacterial infections which can cause more mortality than this coronavirus. But what is actually happening is there is something at the back of our mind telling that we may get affected, we may get killed. See, this is the fear which have to be removed. Actually, first disease we have to come out of with is to win the war against this fear. The so-called fear is a big disease, and we have to work for removing that disease on our own. Nobody is going to help us to remove this fear. So we have to be bold enough. See, in the army, the soldier faces an enemy who is visible, but the ammunition may come and hit him without his knowledge. Here, we do not see the organism which is going to hit anybody, and we don't know how it enters, how it causes a disease. Why break the head? See, take care, prevent yourself. You know the ways of prevention. So whenever you try to go and look at the organism, don't be afraid. Yes, we have got a simple methods of seeing that droplets do not fall onto you. You don't inhale them. Try to be keeping a distance. Social distancing is what. Please, if you are not a final year student or a student who is worried about the final year that you are missing the clinical classes, go for health education. Around your house there are many people who do not know any of these things. Kindly educate them. Go on. See, doctors are best teachers in this type of situation. Take care, do the needful, help the society, help the patient. All the best. Thank you very much.
Thank you, sir, for those very inspiring words. I guess to summarize Sir's talk, Sir has a message of courage to give all of us during these difficult times, to tell us that we can come out of this with a strong resolve, and we can definitely come out of it with a good academic perspective, and that the only thing which in general we do need to fear is fear itself, and to combat fear by keeping ourselves academically oriented. With that, we now move on to listening to Dr. Chitra Nagaraj ma'am, who is a professor and head of department at the Department of Community Medicine at PS Kuppam. Ma'am too has a short motivational message for all of us.
Good evening. I am Dr. Chitra Nagaraj, Professor and HOD of Community Medicine at the PS Medical College at Kuppam. Corona. We are hearing so much of it nowadays. I am in my 6th plus decades year of my life. This is the first time we are seeing something like this. It's really scary. We have seen the developed countries also going through a very, very bad phase, and now we are seeing the repercussions in India. What we learn from this is life is unpredictable. We need to learn to adapt, and those who can adapt will survive. I will tell you a small story here. The story of the ant and the grasshopper. Most of you might have read it as fables in your school time. The story goes like this. The ant and the grasshopper, both of them were living in a forest. The ant would be very busy all the time collecting food, and the grasshopper would be enjoying, dancing, singing. Every time the grasshopper met the ant, he would tell, "Why are you working so hard? It's time to enjoy, play and sing." But the ant would continue with its work. And finally, this was the springtime, and finally when the winter came and the whole area was covered with snow, the grasshopper did not have food to eat, and the ant was one safe and secure in its home and able to eat. Now why I am telling you this is, as students, you've got a break. Now how you utilize the break is up to you, either as the ant or the grasshopper. So if you're an ant, you would try to utilize this time in a very productive manner, and that would help, because I'm sure it's like the winter for the grasshopper which is going to come, and when that happens, you'll find yourself stressed if you do not plan and do your curricular work accordingly. So what I would suggest, most colleges are having online classes. Please do not miss the classes, attend them, learn whatever you can from those classes. Plus, this MBBS course is an adult learning. It's not that everything has to be taught and spoon-fed. So all of you should make an attempt to do some kind of self-directed learning. Set goals for yourself, look at your curriculum from the university, see what all has to be studied, and then plan accordingly. Make a timetable, study some portion every day, look at your question papers, keep them as a baseline for knowing the must-know topics. If you do that, I'm sure you'll be like the ant, you'll come out of this bad season very productively, and you will do well without having stress. God bless you all, and all the best. Thank you.
Thank you, ma'am, for sharing a very nice fable story with all of us. The story of the ant and the grasshopper, and putting it in context with today's scenario. I'm sure all of us who have listened to this talk will definitely come out like the ant, with a stronger resolve to ensure that we do come out of this pandemic in successful and flying colors.
Hello everyone once again. As we come to the end of this video, this final few minutes is more like a summary. Now, in these few minutes I speak in my role as a moderator, not giving my personal opinions. We've done our best to try to incorporate different views from different levels of the hierarchy in medical education, be it from first, second, third or final year MBBS to intern viewpoints, residents from different departments across the country, and from very motivational faculty as well. Now, the intention of this webinar was try to consider different viewpoints to bring forth our opinions into the public forum, and of course our initial idea was to conduct this via a Zoom platform. Now, a Zoom platform would have of course been would have meant it would have been more interactive, and with more interactive there would have been a point of where we could have maybe discussed a little bit more. Due to work schedules and other risk constraints, it didn't happen, and it might happen in the future at a different setting, we don't know. The key take-home message from all of this is that unanimously we agree that medical education is affected because of the lockdown, and under the current circumstances I guess there is nothing much what we can do about it. A positive motivational message which I would like to give is, don't lose hope, don't lose faith. Have faith on us, have faith on your parents, have faith on the system, have faith on Almighty. I'm sure none of us have ever faced a crisis like this before in our lifetime, and I hope and pray that we never do face such a crisis again in our lifetime in the future. To all of us who are doing residency, and to my junior colleagues who are students right now in different levels of MBBS, all of us have gone through this corona era of our lives, and undoubtedly it would have gone a long way in shaping our careers in the future. Our actions during these times will not define just what happens in these times, but in the future too, both short term and long term. One of the challenges what we face in medicine is society views us as doctors and only as doctors. And as doctors, we all look at ourselves as doctors, of course, but also we see ourselves as people of society. Many times, whether society sees us in that way or not, we are an integral part of society and we do intend to give back to society too. As budding doctors, to all of you who are listening to this talk, all I can say is keep the interests of society in the forefront, and I guess all we should do is take a pledge to ourselves that we will do whatever we can to come out as good doctors, stronger, together, united amidst this COVID lockdown. And of course, as far as the academic aspect is concerned, our professors are always there to guide us, faculty are always there to guide us, colleagues are always there to discuss. And there are many online resources available, there are many offline resources also available. And of course, if we are in a position where we can help out someone through the phone, through video conferencing, to any patient who needs help, even a smile, even a very mild, minimal help, which goes a long way in helping out someone. I'm sure these are difficult times which none of us have faced before in our lifetimes, and hopefully never face again too. But we can't really predict the future, can we? So on that note, I conclude this webinar with the hope that it considered viewpoints from all across the country. I tried level best to see that everyone did get a voice to say, and everyone did get some amount of equal representation too. If you have any feedback or questions, do feel free to post in the comments box. Please do subscribe to the channel also, and if you like the video, please do click the like button. So on that note, I take leave. Thank you all for listening.